Welcome back to Thriving Beyond the Stethoscope. Today we have a special guest with us. It is Brooke. She's a registered nurse. Brooke, if you want to go ahead and introduce yourself.
Hi, my name is Brooke. I'm a registered nurse. I've been a registered nurse for about 8 years now. The first 7 years, I worked at an adult inpatient acute med-surg unit, and now I work in the medical ICU.
That's exciting. So tell us a little bit about what you do in the ICU.
In the ICU, it's very different than it was on the med-surg floor. We take care of all of the very critical patients that may have vents, severe sepsis, um, have really low blood pressures. All those things kind of fall on the ICU for more critical monitoring and medication administration and all the things.
I love it. How did you decide to go from the floor to the ICU?
Um, so I had always thought I would want to go to the ICU at some point. But when I was a brand new nurse, they have a program in the hospital where you can orient with a new nurse. And at that point, I kind of was just like, I want the background knowledge. So wherever you can put me is where I'll go. So I started there and I ended up really loving the surgical patients. But after 7 years, I was a nurse on the floor. I was a charge nurse. I was a preceptor. So I felt like I had reached the peak of where I could go. So then I was like, well, I've always had an interest in the ICU, and the medical ICU has like the medical and the surgical patients. So it's kind of like the next step up. And that's something I found when I was on the medical floor. We had all these sick patients that would leave and go to the ICU. And I like loved that little span where I got to care for them and like try and fix the things. And then they left. And then I never got to see what happened or like continue fixing them. So I longed for that after part. And so that's why I went to the ICU.
Yeah, I love it. Do you like the adrenaline rush with the ICU? Because a lot of people do, from my experience. So what's your thoughts?
I definitely do. I feel like I still, I don't know, 8 years later, I still feel like shaky from the adrenaline.
Sure.
But I do love like the critical thinking aspect of it. And I really like, I mean, it's not always a happy ending, but I do like trying really hard to get that happy ending and like doing the best you can for the patient. And it definitely makes the day interesting. And I try to go to everyone else's emergencies. So I guess I am kind of a little bit of an adrenaline junkie in that aspect, just because I love seeing and learning all the things that go along with it, especially if it's not my patient. So I can just kind of be in the background and be like, I'm just gonna take all this in because I'm still new to the ICU. So there's a lot of like situations that I haven't experienced yet.
Sure.
So I sometimes prefer to experience it at someone else's expense. So that later I don't have to like go back and think, oh, what are all the things I have to chart? What are all the things I did? I can just kind of absorb what they're doing and like take that in. So
I think
if
we
I
are
experience it on
so
my
much
own.
alike. I'm the same way where it's like, I feel like in school, and we'll talk about this in a minute, you can only learn so much from a book. And it's more about
Mhm.
like, really, what did somebody do wrong? Or what should somebody have done in a different way in whichever situation? Or what did they do that went right? And then you can learn from that. And then you can try
Mhm.
not to replicate the errors and like
Yeah.
do the good side. I also love surgery. That's my favorite. So when you talk about
Yeah.
surgical patients, we're just two peas in a pod because I love
Mhm.
it. Okay, great. So tell me, I guess, what inspired you to become a family nurse practitioner to start that process?
So while in nursing school, I had always anticipated that one day I would go back to becoming a family nurse practitioner. Once I like hit the med surg floor and I was a nurse, I really just fell in love with bedside nursing, which is not super common for a lot of people, but I really did enjoy it, and I really enjoyed the surgical patients. So I kind of put going back to school on the back burner. I did go back for my bachelor's because I started with an associate's, but then I was like, well, I don't really want to leave the bedside, and I enjoy like the direct patient contact, and I was worried about leaving that and like having limited time with the patients.
Sure.
But then I had my daughter, and so I don't know. You always strive to be the absolute best for your kids, and I want to provide like a better life for her and my husband and my family. And my husband works 12 hours and I work 12 hours, so it's not great for family life balance. And often days we are opposite each other, so we don't get a lot of time together. And then I don't want to miss out on weekends and holidays with her. So that was like the main driving factor. Like it was always in the back of my head, but I was just comfortable where I was. Um, but knowing like I don't want to miss all those things and I want to provide a better future is what pushed me to deciding to go back. Um, so that's how I ended up here.
No, I love it. It's a great driving force to get you to your next step, you know. Kids, they motivate us to do all kinds of things, so that's really exciting. Um, just curiosity's sake, since you transferred over to the critical care side of things, what made you choose a family nurse practitioner instead of acute care nurse practitioner?
So I did contemplate both.
Mhm.
When I was deciding to go back to school, I looked at all the different programs that you could do as a nurse practitioner, and I did think about it, but I'm trying to get out of the hospital
Oh, that's
um,
right.
for the better
And the
hours.
work-life
So that's
balance.
when I decided acute care. I love seeing all the things they get to do. They're super smart and they basically run the entire ICU.
Yeah.
So I do love watching all the things I get to do, and it does like intrigue me. But that would lead me to probably worse hours, and I wouldn't get my end goal of like wanting more quality time with my family. And so
That makes
that's
sense.
why I decided the FNP route was the best for me. And I didn't realize when I decided that there's so many different avenues that you could take. I really just thought it was like primary care. And then like as I've been in the program, and like talking to other nurse practitioners and asking them like what's your degree. I've even learned that like some of the FNPs are inside the hospital, which I didn't realize you could do,
Hmm.
as like palliative care. And there's a surgical nurse practitioner that works in the hospital, so I just didn't realize how vast it was. So it makes me a lot more excited that I'm not just stuck with primary care. I was afraid, with my little adrenaline side, that I might get bored in the
Yeah.
primary care aspect. So I'm happy that there's a lot of different avenues I can go in.
I can definitely say the same. And that's why I try to talk to younger students, like in high school, because I didn't even realize how many things there were. Like, you can go into oncology, like I did, and learn. You can go into cardiac and learn GI, surgery. I
Mhm.
mean, like you said, you're not just honed in to the primary care office Monday through Friday, 8 to 5, which is great for some things and not so great for
Mhm.
other things. They even have like the home health aspect of it where you can go to people's homes if you like and make your own hours and dermatology. So I think that's why I like nursing in general and nurse practitioners because I'm not closed into a box. I can always learn more. And that sounds like you as well. And you can always change your situation. I love it. So do you have a specialty that you might be leaning more towards or thinking of, especially as you talk to people?
Um, I feel like it's hard for me to decide because in school, I haven't started clinicals yet, but in school, they don't let you follow specialties, which I think it makes it a little limited for like you deciding down the road what you want to do. Because how do I know I want to do that if I've never gotten to see it? So two things that I have thought of just because I love the surgical aspect is, maybe trying to see if I want to go down that path. But I also, since being in the ICU, I've worked a lot with palliative care. Um, it's not something I would have ever thought about on the med-surg unit because I never saw a lot of death and dying. If our patients were really sick, we sent them out, never saw it again. I don't know what happened. So now that I'm the one that's there and I'm the one that's talking to the families about the palliative process, and my mindset has changed about how it's a lot of time compassionate versus like
Mhm.
a really sad ending. A lot of times it's those patients that you are just hoping that the family is gonna let them go peacefully because you've watched the suffering. So I feel like that aspect makes me think about doing that as a provider because I've gotten better at those conversations in the ICU, and I don't see it as a sad thing as much anymore. A lot of times I see it more as compassionate and another way to help the patients, but now the families too.
I think you put that in a great perspective because usually when I talk to patients, like when I was in oncology about palliative care and hospice care, they're immediately like, you could just tell the shock and the fear because they don't even know the difference between palliative versus hospice. And then you have to
Mhm.
remind them too, it's all about patient choice, patient autonomy. They need to understand their decisions. And then, like you said, it is a compassionate way for them to leave the world comfortable instead of people thinking
Mhm.
of it like a death sentence. And
Yeah.
I'm sure you've seen it a lot, especially critical care or even in med-surg, where people are making their loved ones like hold on longer. And then just because they want them around, but then the loved one is suffering, and then you have to see that most of the time. So
Yeah.
I do like your
It's
compassion. I like your thoughts. I love my hospice and home and palliative care nurse practitioners. They're amazing, great hours, great pay. So it's a good route to go to. Good work-life balance. What would you say has been the biggest mindset shift from being an RN to transferring over to an FNP?
um there's been a lot of shifts. It's easy, like as a nurse, I feel like for the most part I know what I'm doing. Maybe not so much in the ICU, but like med surge, I got that. ICU, I'm starting to finally feel comfortable, and now I'm going on to the NP role and learning all kinds of new things that I didn't learn as a nurse. And so I'm like, wow, this is a lot of new information I didn't know about. And it kind of makes you feel like a little inadequate because you're like, I thought I was prepared because I felt really good doing all of this in nursing. And you think it's gonna like, I mean, it does pull over,
Sure.
but there's a lot more to it than you expect. So I just feel like that shift of feeling confident to no longer feeling confident
Yes.
is probably one of the biggest things. And then also trying to figure out how to juggle going back to school. I've never had a kid while I was in school. Like my associates in my bachelor's, I had before I had my daughter. So now
Mm.
the balance of working full time, having my daughter who's 2, and then also trying to do all the schoolwork and keep up on that. That's been a really big shift, and I've had a lot of hard time like trying to figure out how to maintain that balance and not be overwhelmed and stressed all the time and cry every day.
Yes,
So
I think in nursing school we all diagnose each other with mental health disorders, and we probably had them temporarily, so I understand.
yeah, this semester I definitely feel like I found a better balance than the first semester, but I feel like the first semester, since it was just so new,
Yeah.
it took me like all of the tears and all of the trial and error to get through to how I am now, which is much less stressed,
Yeah.
and like a better balance overall.
Yeah, that's great. I remember early on, even in my current career, I've done school like throughout my whole life. I've always been in school, I think, since high school and working multiple jobs and having kids. So it's definitely about finding that quality of time, right? So like you have all day while they're in school to get your work
Mhm.
done, and then I usually set a few hours. I don't know if this is what you do, but I set a few hours in the evening to just be focused on them, intentional time with them and the
Mhm.
husband, because we can't forget about those guys. And then at a certain time, like when they go to bed, I'm back in it, right? So probably you too, back in it to studying or completing your charts from the day or whatever the case may be, which
Mhm.
probably not so much you with charts for ICU, but when you're an FNP, you can take those charts home, which is horrible. Don't do it. Figure out a different pathway. But then I'm up late studying and then it starts all over again. But you're right,
Mhm.
finding intentional time with family, but also taking care of yourself. And this is where my mental health nurse practitioner comes in. It's coping and working out or meditating, or I love
Mhm.
art therapy. Oddly enough, we were painting rocks in mental health, and I was like, I like this. I'll do this. So I love your mindset. I love your balances. I love your coping, intentional with children and family because they're your support, right? They have to take care of
Mhm.
us too. Um, what advice would you give nurses that are considering going back to school to be a nurse practitioner?
Some of that goes back to, finding a good life balance. I probably now would recommend going back for your NP before you have children.
Great.
Just because it'll give you more time to do all the things. Like you said, my daughter goes to daycare, so all of my schoolwork is crammed into that time that she goes to daycare, and then after she's home, I don't touch anything because I before I started the program, I didn't want to take away from her.
Mhm.
So that's been like my biggest goal is to not do that. So I say if you have kids, find a good balance. Don't be ashamed to put your kids in daycare. There's a lot of like stigma around, oh, your kid's in daycare. And my patients all the time, oh, where does your daughter go when you work? Oh, she's at daycare. And then they instantly like have like a little sigh. I'm like, it's not a terrible thing that I'm doing. I'm doing this for her. I'm trying to make our life better. And so don't be ashamed of that aspect. Um, I would say look at all the different programs and tracks that you can do because there's a lot. I did a lot of research before I decided on my school. There's a lot of online programs that you can do, but there's also, you have to look at, do they have like in-person intensives that they do, things like that,
Mm-hmm.
which is something I wanted. I wanted an in-person intensives for sutures and stuff. So that's something I took into consideration. Um, Also look at the cost because the cost is a very big variety.
Vastly different,
um,
right? It's
and it's
crazy.
not all like there's certain schools that are lower cost, but they also have really good education. So you just have to kind of look deeply into all of that. Um, and then just, practice time management, get a planner, talk to your family about what you're going to be doing. Before I did this, me and my husband had a lot of conversation about how he's going to have to do more around the house. I'm not going to be cleaning every day because I need to be doing homework. So we had to find a good balance for that. And he understands the
Good.
goal at the end and he knows it's going to be better for us in the end. So he's willing to pick up where he can. So just a lot of communication and organization.
I think that's really healthy and unusual. So I'm glad to hear that you do that. Like that's, and I say unusual because it doesn't always work out that way. So I'm glad you have a
Mhm.
supportive family and husband,
Yeah.
and of course your youngin's 2 years old. They want all your time, so they won't
Mhm.
understand. But you're doing great.
Yeah.
Um, what you kind of probably touched on this a little bit already, but what do you wish that you would have known before starting the program?
Um, I wish I would have known how much more stressful it was going to be. I've always felt like I was good at school. I never, like, even my associates in nursing, which was like my first nursing program, I never felt the stress that I do now. I don't know why I didn't assume it was going to be stressful because a master's program is going to be stressful. I don't know. I just thought I was always good at school and I have the basic knowledge now that I didn't when I first went. So I was like, it'll be fine. So definitely consider that it's going to be harder than you thought, but that it's still possible. And you just got to find new coping mechanisms and support systems.
I absolutely love it. And I know you talked earlier a little bit about that imposter syndrome, which we didn't identify it as, but it is. It's imposter syndrome where you feel like when you're actually a nurse practitioner or you're going through school and you're like, I shouldn't be doing this. How am I supposed to be doing this? Am I supposed to order these meds or is that the doctor? Who does this? So, what are your thoughts about on how you're either handling it now or handle it in the future, that imposter syndrome?
I feel like you kind of have a little bit of that as you go through, like even just your nursing careers, because I felt that when I went from med-surg to ICU, I felt so confident in med-surg and I was at the top. And then I went to the ICU and I was at the bottom again and I felt like I knew nothing. So then I was like, well, I don't know if I can really be here. I'm not as smart as them. And so that's kind of the same as, going back for my FNP.
Good point.
There, especially working in the ICU where you work really close with all the advanced providers and you see how smart they are and you're like, oh, that's not me. But then I just have to remind myself that I'm only in semester 2, so there's a lot to learn and I haven't gotten to the clinical aspect where I feel like you learn a lot of the material because that's how it was for my actual nursing program. Um, so you just have to understand that you're not going to know everything, that it's going to grow like my nursing knowledge did. So
I agree. I
try
think
to
it's
look
a
at it that way.
Yeah, I think that's a great way to look at it because so many people feel that where they feel incompetent, right? Like, because like you said, you
Mhm.
did great. Like, you're at the top of the food chain basically when you're at your nursing area, and then you switch over and you're like, God, I didn't realize how much I didn't know, or now I have to
Mhm.
actually be able to apply it because I'm responsible for it. So
Yeah.
you're right. It is all about competence and confidence and getting that knowledge to make you feel more confident. So I love
Mhm.
it. Um, would you do it again? Would you make the decision to go back to school to be a nurse practitioner?
I think so. I would probably do it sooner. Like I said, before my daughter. Just have like it all set up and then have a kid. But I don't regret going back and doing it now because I'm trying to make our life better for her and um, have that better balance. So I would definitely do it again. Um, yeah. I think overall it's going to be worth it in the end. My husband is constantly reminding me that my stress and my hard work and all the things are going to pay off in the future. And he has lots of plans for my future money.
I was just about to say that. It's funny. I think
So
husbands are alike. I'll
he's
leave it at that.
always reminding me how great it's going to be for him.
Yes, yes. They think that they can retire early. Get out of here.
Yep.
Still got to work. Take care of the kids. um, this is the next question is about the education that you're receiving in general. And remember that any program that we take, it doesn't matter what it is, there could always be areas of improvement, right? Whether that's the material or how people provide the information, etc. Like I have a bachelor's degree in biology, right? Biological science. So I have thoughts on how that could be better versus like my nursing and nurse practitioner, education, how that could be better. I just don't want viewers to be like, oh, see, nurse practitioners, they don't know as much as they need to know, or they don't get the education that they need, because sometimes that's an argument from the other side, like with certain other professions, which I don't believe in competition. I believe we're all collaborative and need to work together. And I think that as a whole, our education system could improve. But if you're thinking back to like your education in general, or even your nurse practitioner education, is there a way that you would think that you would redesign it, or what you would change to it?
Particularly for like nursing programs and my FNP programs, I feel like they're not the most organized. Um, and even like comparison to the nursing students I get at the hospital, they're all talking to me about their programs and all the unorganization and things that they would change. It sounds like it's like across the board. It's not just like the school I went to for nursing. It's not
Mhm.
just their school. You hear it from multiple people as that organization is lacking, which is interesting because we need to be really organized to be providers. So I think that's why it's hard for us as like students and um, providers to work in an environment that's not super organized.
Mhm.
So the programs, they definitely lack in that area sometimes. And then I also wish that there was more studying resources available.
Mhm.
My FNP program is all online, and my first semester I took pathophysiology, which is a doozy.
It is.
And the teacher was not the best at teaching it. So I basically felt like I had to teach myself. And, moving forward, I'm like, what if I go through this whole program and I don't learn anything?
Yeah.
So those are like fears that you have just based on like the resources that are sometimes available.
Yeah.
This semester, my professors are a lot better at explaining pharmacology and all those things. So
Good.
I just feel like better resources, like if you're not great at teaching this, just find us resources that might be good at teaching this.
Yes.
Um, so like my pharmacology class, they're using like an outsourced program to teach us.
Mm.
Um, and it's like a past nurse who turned into a doctor who turned into a pharmacist. So he knows all about the drugs.
Yeah,
So
clearly.
I think just using that program alone, I think it was smart for them to realize, hey, like this is a big topic. Maybe we should outsource it so that our students have like a better experience. And I don't think that's a bad thing. I think that's a good thing that schools could do. And I wish I got that for patho because I feel like I would have learned a lot more had it been taught by someone who might be a little bit better at teaching it. Um,
Absolutely. And I could say that even for my chemistry class back in my biological science degree. So
yeah.
I I can definitely agree with that. And when I got out of nurse practitioner school, I'm big on protocols and guidelines. And that's why I love oncology so much, is because we have the NCCN guidelines that we follow for almost every type of treatment. So I tried to go on to the family. Oh my gosh, I'm going to mess it up. Oh gosh. It's like the Family Medical Doctors website. So it's for MDs that are in family practice. And I'm blanking on the website or what it's called, but basically it has guidelines in there and it has information and resources, but they don't allow nurse practitioners to join and they don't allow them access to the resources, which I really wish that that would change because I think we all could help patients better if we all have access to the same resources. We could also have the similar knowledge base too, right? If,
Yeah.
they're being taught one thing and we're being taught another, which is sometimes the argument. I don't know if that's necessarily true because medicine is medicine, but it'd be great to have access to resources. And I
Mhm.
think as you go through your clinicals and you get out there and you do a lot of your research, you're going to find those resources to actually help you when you're in the practice. And
Mhm.
there's a lot of things out there now, just for your own knowledge and for people who are listening to. Open Evidence is a platform. It is an AI platform, but it's based off of scholarly resources and articles, and it'll give you all the references. And it's more direct, but it also explains the rationale behind a treatment plan or a medication to you. So it's not Chat GPT. It's not something that's not official or formal. You actually have to put your NPI into it and you can get it for
Oh, nice.
free. And you can claim CEUs on it as well too. They also
Oh,
have a
wow.
program in there too for the medical doctors to be able to study for their boards. So it's legit, it's great, but you'll learn that as you go through clinicals and learn from others. Hopefully that experience is what it'll give you to get more
Mhm.
resources. Um, let's see. I have a couple more questions here. Okay. So since you're going to be going into clinicals, what's your thoughts or ideas of what would make a preceptor great? Like what are some qualities that would be really helpful in a preceptor versus some qualities that might not be so helpful?
I think like the biggest quality would be someone who's actually eager to teach. I learned a lot from my past like nursing clinicals that a lot of the nurses were just thrown students and they didn't actually want to teach, they didn't care to teach, so you learn nothing. Something I've taken away from that experience is every time I have a student, I try to be open and show them everything. And I understand it's going to slow things down. But I want to give them that one on one hands on experience in like a comforting, calm environment because that's what I want for myself. So I think someone who's eager to teach, someone who's going to be patient. I am very like oh, sorry.
No, you're fine.
I'm very hands-on. So I prefer someone not just show me like what they're doing, but let me do it. I think I learn better by doing than seeing. Sometimes, seeing first is good, but then like after, just let me do it so I can muscle memory and remember all those things.
Absolutely. The OR, they taught us see one, do one, teach one. So
Mhm.
I was gonna say, if you need to get water, go get water. It's no problem. So yeah, I definitely agree with that, and that's how I practice too. Because like we were talking about earlier, right? We learn from others, we learn what we like, and we learn what we don't like. And I agree with all the qualities that you're talking about. And I even saw that as a nursing instructor when I try to place students with nursing preceptors, the ones that wanted them and didn't want them, and yeah, we're
Mhm.
the same page. Love it. Um, Last question I have for you is how can practicing nurse practitioners better support students?
Um, it kind of goes back to the last statement is definitely foster an environment of like learning and encouraging without making them feel stupid or inferior or like they should know it already because this is where we're coming to learn. Yes, we're learning a lot of the textbook stuff, but like I said previously, a lot of the learning is done hands on. And especially if it's their first clinical, it's good to have someone who's going to foster like a healthy start environment. Um, I also think it would be nice if they could have tips and tricks and resources for us. Like if, say, I come to you and I'm in a certain class and I'm struggling with that, I can tell you about it and you can maybe give me some tips on how to remember things or resources, like you said. And then maybe like help them. It's very hard to find preceptors. So if they have any people that they know or just a list maybe of people that might be willing to, that might be helpful for their future students to like have somewhere to go to next, and create like a little train. Just because it's hard, especially in Southwest Florida, to find preceptors, and um, that was one of the reasons why I was concerned going to school, because I didn't want to get through all this and then get stuck and not find somebody. So if they are well versed in the community and have people that they know of, it's nice to have someone else to ping off of.
I couldn't agree more yet again. I remember when I went through my FNP and I was trying to find a preceptor, I had a list and it was like 20 different places all in this area, and they just weren't taking students, or they wouldn't call you back, or
Mm-hmm.
I can't even think of them all. And we travel so far to be able to do different preceptorships and learn. And I can definitely say, with my experience for education, that's one thing I think nurse practitioner school is lacking, is the support to have a clinical rotation for you.
Mm-hmm.
Except that I know it's difficult because they could be from a different state and they don't necessarily know your state.
Yeah.
And that was a concern for me when I went back to school to be a psychiatric nurse practitioner, because that seemed to be even harder and people were charging a lot of money for it. So yeah, so I'm very thankful that now I can do the preceptorship for people at my clinic, Thrive Wild Medical Center, which should be opening hopefully here in April, as we both know. And then for psychiatric nurse practitioner, I'll do that as well, but that'll come probably about December of this year. And then just trying to connect everybody. So even creating like that Facebook group, the Florida, I can't remember what I did for it now because we're talking about it, but it was the Florida NP Preceptorship Connection, if I remember correctly. Um, I will tell everybody, so that now we're on YouTube. Connecting with your local nurse practitioner council or group or professional group can help to be able to get connected. So like, I'm with the Nurse Practitioner Council of Collier County. I'm also a member of the Lee Health or Lee Nurse Practitioner Group, and Broward. There's a nurse practitioner group over there as well. And then the Florida Flan P and FNPN, sometimes they'll be able to help out as well too. So just future thoughts for people wanting to go into FNP, psych, get with your professional boards, your local groups. Sometimes you have to use professional, resources or references. Ask people if you work at a major hospital system. Sometimes they'll take you, sometimes not. And then, of course, FNP, you have to have the pediatrics rotation, or you have to have at least so many hours of pediatrics. And sometimes I found that was hard to find until I found a clinic who did it all.
Mm-hmm.
But pediatricians, I've found so far, don't typically like to take on NP students, only because they know that they're not necessarily going into that practice. So they wonder,
Yeah.
why would I spend that time with them? And that's just my own personal experience, what I experienced. So, anything else, Brooke, that you want to share or think anyone needs to know about, whether it's nursing or going back to school?
I feel like we mostly covered everything. Like you said, I joined a lot of Facebook pages
Mhm.
for students looking for preceptors, and then I joined the local Facebook groups for the um, nurse practitioners, and that's how I ended up finding you.
Yeah.
So it's a good way to network. Even if you're not reaching out, you can see like all the different people who have made suggestions or who have found preceptors on there, which is what I've been doing a lot of. I just go back, search if anyone's in my area, and see like who's responding and what the recommendations are. It's a good way to start, just because if you go out blankly with searching primary care offices in this area, you're going to find a ton. So,
Yeah.
and most of them won't respond to you
Yeah.
because most of them didn't respond to me. So,
So I have the
but
same
just keep
problem.
pushing through. Eventually, you'll get where you need to go. It just might take a little bit longer and a little bit of stress, but it'll be worth it in the end.
That's right. I love it. One last thing I thought of are pharmaceutical dinners. If any, have you ever gotten those at the hospital? Do they ever advertise to you, like the pharma reps who do dinners out in town? No? Okay. I
No.
don't I don't know if I know about it because I created so many with oncology in Naples, but if people can get involved with their pharmaceutical reps or their companies, whether it's their hospital system or if they work out like in town in an office, they will do these rep dinners where they pay for your dinner and you can come out and you can learn about their product. But that brings together all these nurses and nurse practitioners. And again, that's more networking and that's more options for students. So great. Thank you so much, Brooke, for coming on today. I really appreciate it.
You're welcome. I
Awesome.
enjoyed coming, and I've enjoyed speaking with you, and I hope to learn a lot from you.
Yeah, I'm excited. So, future coming. All right. Well, thank you for joining us on Thriving Beyond the Stethoscope. Don't forget to like and subscribe. You can always reach out with questions, and we look forward to seeing you on the next segment.